You know, it seems like every day we hear about some amazing new way AI is going to like revolutionize healthcare.
Right.
And today we're going to look at one area where that potential is starting to become a reality, and that's cancer treatment,
Okay.
specifically immunotherapy. And we're diving into this really fascinating study about an AI model called Scorpio that is showing some real promise in actually personalizing immunotherapy.
It's definitely an exciting development.
Yeah.
You know, immunotherapy, it essentially works by like taking the brakes off the immune system so it can attack cancer cells much more effectively.
Yeah.
But the thing is, it doesn't work for everyone.
Right.
And it can be super expensive and have some potential side effects. So
Yeah.
figuring out who's actually going to benefit from it,
Yeah.
that's like a major challenge in oncology these days.
And that is where Scorpio comes in.
Right.
It's using AI to predict immunotherapy outcomes.
Yes.
But what's really interesting to me is that it's using data from those like routine blood tests we get as part of a regular checkup. Like I go to the doctor and they're like, we're going to take some blood. And I'm like, okay,
Yeah.
you know?
Totally routine.
Yeah, totally routine.
It's using complete blood counts and metabolic panels.
Okay.
So like the kind of tests doctors order all the time.
Yeah.
What's really impressive is that Scorpio's finding these patterns within
Yeah.
this readily available data
Uh-huh.
that can actually predict how well someone might respond to immunotherapy.
So instead of relying on like more complex and expensive data,
Yeah.
like genetic testing or tumor biopsies,
Right.
Scorpio's using information that's pretty much already being collected in most hospitals.
Yeah, exactly.
So it seems like this is a huge step towards making personalized medicine way more accessible.
Absolutely. If we can use data that's already being generated to guide treatment decisions,
Right.
it could have like a really significant impact on, you know, the cost
Yeah.
and accessibility of like personalized cancer care.
I know AI and machine learning can sound kind of intimidating to a lot of people. Can you break down like how Scorpio was actually developed? Like
Yeah.
what was the process of teaching it to make these predictions?
So essentially, the researchers used this massive data set
Right.
from over 1,600 patients who were treated with immunotherapy at Memorial Sloan Kettering Cancer Center.
Okay.
And this data included those standard blood test results I mentioned,
Mm-hmm.
along with information on how each patient actually responded to the treatment.
Okay.
And they use all of this data to train Scorpio, essentially teaching it to recognize these subtle patterns within the blood work
Oh, wow.
that correlated with treatment success.
So they basically fed Scorpio a ton of information and then let it figure out the connection between those blood test results and how well the immunotherapy worked.
Yeah, that's a great way to put it.
Like teaching a computer to read a language it's never seen before.
That's a good analogy.
Yeah.
And like learning any language, you know, the more data you're exposed to, the better you become at understanding it.
Right.
The researchers were essentially giving Scorpio this crash course in the language of the immune system,
Uh-huh.
but as reflected in blood tests.
Okay, so they trained Scorpio on this huge data set.
Yes.
But the real test is whether it can actually make accurate predictions on patients it hasn't seen before.
Right. That's the real test of its intelligence.
So how did they go about validating its accuracy?
So to make sure that Scorpio wasn't just memorizing the data it was trained on,
Right.
they tested it on a completely separate group
Okay.
of over 2,100 patients from the same hospital.
Okay.
And this is a really crucial step to make sure that the model could actually generalize its learning to these new cases.
So like any good student, Scorpio had to prove it could apply what it learned
Yes.
to a whole new set of problems.
Exactly.
And how did it do? Did it pass the test?
The results were really impressive.
Okay.
Scorpio accurately predicted which patients would benefit from immunotherapy
Wow.
and which ones wouldn't.
Uh-huh.
And this wasn't just a one-time fluke. They tested it on several other data sets,
wow.
including data from Mount Sinai Health System
Okay.
and even 10 global phase 3 clinical trials.
Wow. So we're talking about over 4,400 patients
Yes.
from different hospitals and even different countries.
Yeah, different countries across the world.
That's some pretty rigorous testing.
It is.
Yeah.
And what's even more remarkable is that Scorpio wasn't just accurate.
Yeah.
It actually outperformed the existing FDA-approved biomarkers for predicting immunotherapy success.
Oh, really?
And, you know, those are the tools that doctors currently use
Okay.
to help them make treatment decisions.
So we're talking about a potential alternative that might actually be more effective
Yeah, potentially more effective.
than the current gold standard.
Right.
That could have huge implications for how we approach immunotherapy.
It could really change things.
going forward.
Absolutely. And the fact that it's using data that's readily available
Right.
and relatively inexpensive
Yeah.
makes it even more compelling.
This is where it gets really fascinating to me. It's not just about predicting immunotherapy outcomes.
Yeah.
It's about the potential to make personalized medicine a reality for so many more people.
Right.
I'm really curious to explore that aspect a bit more.
Okay.
Can we dive into the specific benefits of using a tool like Scorpio in clinical practice?
Definitely. Certainly one of the most significant benefits is that we can start tailoring treatment plans to individual patients.
Okay.
So, imagine a scenario where a doctor is considering immunotherapy for a patient.
Mm-hmm.
Instead of just relying solely on traditional biomarkers,
Yeah.
they could use Scorpio to get a much more precise prediction
Okay.
of how that specific patient might actually respond.
So it's like having an extra layer of information, almost like a more refined lens to view the patient's individual situation.
Exactly. And think about the benefits for the patients themselves.
Right.
If we can identify the patients who are unlikely to respond to immunotherapy,
Oh.
we can potentially spare them from going through a treatment. That might not even benefit them.
Right.
And, might even lead to unnecessary side effects.
That's a huge consideration.
Yeah.
Avoiding those potential side effects and even the financial burden
Right.
of a treatment that might not work.
Exactly.
It's about improving the quality of life for patients
Absolutely.
as well as their overall outcomes.
It's about moving away from that one-size-fits-all approach
Yeah.
to a more personalized and patient-centered model of care.
And you mentioned earlier that Scorpio uses data that's already readily available.
Yes.
Does that mean that it could be more cost-effective than other methods of predicting immunotherapy response?
That's definitely a possibility.
Great.
Traditional biomarkers often involve additional testing,
Yeah.
which can add to the overall cost of treatment.
Right.
But since Scorpio just uses data from those standard blood tests,
Yeah.
it eliminates the need for all those extra procedures,
Right.
which could potentially lead to significant cost savings.
That could be a real game changer, especially considering, how much the cost of healthcare is rising.
It really could.
Making personalized medicine more affordable could make it accessible to so many more people.
Exactly. And it's not just about cost. It's also about accessibility.
Okay.
In terms of infrastructure,
Uh-huh.
many parts of the world just lack the resources for sophisticated genetic testing
Right.
or complex tumor analysis.
Yeah.
Scorpio relies on data that can be collected with basic lab equipment,
Right.
making it potentially viable even in resource-limited settings.
That's a really important point if we want personalized medicine to benefit everyone.
Yeah.
It needs to be accessible globally, not just in, high-income countries.
Absolutely. And that's where, using those routine blood tests is even more significant.
Yeah.
It's a common denominator in healthcare systems all around the world,
Right.
making Scorpio this potentially universal tool for personalizing cancer treatment.
We've talked about all these potential benefits.
Yes.
But as with any new technology, I imagine there are limitations in areas where further research is needed.
Of course, as promising as Scorpio is, it's important to remember that this research is still in its early stages.
Okay.
The studies we've talked about so far,
Yeah.
they've been retrospective, meaning they analyze data that was already collected.
Okay.
Now, while this is an important first step, we need prospective studies to really validate its effectiveness in real-time clinical practice.
So it's like taking Scorpio out of the classroom and actually putting it to work in the real world.
Exactly.
We need to see how it performs when doctors are using it to guide treatment decisions for their current patients.
Yes, and those real-world scenarios will be crucial for identifying any potential limitations
Okay.
or adjustments that need to be made, for example. The researchers themselves have emphasized the need for further testing with more diverse data sets.
Why is the diversity of the data sets so important in this context?
Well, it's about making sure that Scorpio is accurate and effective for everyone, regardless of their background or ethnicity.
Uh-huh.
The initial studies were mainly conducted in the U.S.,
Okay.
so we need to make sure that the patterns Scorpio has learned
Yeah.
actually hold true across different populations around the world.
It's like making sure new medicine has been tested and proven safe and effective for people of all ethnicities and genetic backgrounds.
Exactly. And it highlights the importance of international collaboration in medical research.
Yeah.
Bringing together data from different countries and cultures
Right.
will be key to developing AI tools that are truly globally applicable.
So where do we go from here? What are the next steps in the development of Scorpio?
Well, the researchers are already taking steps towards real-world application.
Okay.
They're working on refining the model and conducting prospective clinical trials
Okay.
to further validate its effectiveness in these real-time clinical settings.
So it sounds like they're really committed to bringing Scorpio from the realm of research into the hands of clinicians, where it can actually make a difference for patients.
Exactly.
What's that implementation process look like?
Well, it's likely to be a phased approach,
Okay.
starting with pilot programs in select hospitals.
Okay.
This will let researchers gather feedback from the doctors and monitor how Scorpio is actually being used in practice.
So it's not just about handing doctors this new tool.
Right.
It's about making sure that they can integrate it into their workflow
Exactly.
and that they have the support and training they need to use it effectively.
It's a process.
Yeah. And it'll be important to monitor the impact of Scorpio, not just on clinical outcomes, but on things like, the cost, the accessibility, and patient satisfaction.
Absolutely.
It's about looking at the bigger picture,
Yes.
understanding how this technology can be implemented responsibly and ethically to really maximize its benefits for both patients and the healthcare system as a whole.
You've hit the nail on the head. It's important to remember that AI tools like Scorpio are not meant to replace doctors, but rather to empower them with more information to make better decisions.
It's a collaboration, a partnership
Exactly.
between human expertise and the analytical power of AI.
The ultimate goal is to use these tools to improve patient care, personalize treatment plans, and ultimately save more lives.
While Scorpio is focused on predicting immunotherapy outcomes, it seems like this type of AI-powered analysis could have applications in so many other areas of medicine. It feels like we're just scratching the surface of what AI can do in healthcare. What other areas could benefit from this type of analysis?
The possibilities are really quite vast if we can use AI to find patterns in blood work that predict responses to cancer treatment. It's not a stretch to imagine applying similar approaches to other diseases.
Right.
Like, for example, researchers are already exploring the use of AI to identify early warning signs of heart disease or Alzheimer's disease, also using readily available data like blood tests and medical records.
That's incredible to think about identifying those at risk for serious diseases before they even develop symptoms could be revolutionary in terms of prevention and early intervention.
Absolutely. Early detection is often key to successful treatment, and AI could play a crucial role in helping us identify those who would benefit most from proactive interventions.
Yeah.
Imagine a future where we can identify individuals at high risk for Alzheimer's and intervene with lifestyle changes or medications that could delay or even prevent the onset of the disease.
It's a powerful vision, shifting from a reactive approach to healthcare to a more proactive and preventative model. It feels like we're on the cusp of a paradigm shift in how we approach health and wellness.
I think you're right. AI has the potential to transform not just how we treat diseases, but how we understand and manage our health throughout our lives.
So as we wrap up our deep dive into the world of AI and personalized medicine, what are the key takeaways you want our listeners to walk away with?
Well, first, I think it's important to appreciate the incredible pace of innovation in this field. What seemed like science fiction just a few years ago is rapidly becoming reality. AI is no longer a futuristic concept. It's a powerful tool that's already making a difference in healthcare.
And it seems like that impact is only going to grow in the coming years.
Absolutely. Second, I want to emphasize the importance of approaching AI in healthcare with a balanced perspective. While the potential is vast, it's crucial to remember that AI is a tool, and like any tool, it can be used for good or for ill. We need to ensure that its development and implementation are guided by ethical considerations, prioritizing patient privacy, safety, and well-being.
So it's not just about the technology itself. It's about how we choose to use it. It's about ensuring that AI serves humanity, not the other way around.
Yeah, exactly. And finally, I want to encourage everyone to stay informed and engaged in the conversation about AI in healthcare. This is a field that's evolving rapidly, and it's going to touch all of our lives in one way or another. The more we understand about its potential and its limitations, the better equipped we'll be to navigate this new landscape and shape the future of healthcare in a way that benefits everyone.
It's a call to action, a reminder that we all have a role to play in shaping the future of health and medicine.
Precisely. And to leave our listeners with a thought-provoking question, if AI can unlock such valuable insights from something as readily available as blood work, what other hidden treasures might be waiting to be discovered within the vast amounts of medical data we're already collecting? What other breakthroughs might be just around the corner? The possibilities are truly mind-boggling.
It's an exciting time to be alive, witnessing the convergence of technology and medicine in ways that were once unimaginable. Thank you for joining us on this deep dive into the world of AI and personalized medicine. We hope you've enjoyed the journey, and we encourage you to continue exploring this fascinating and rapidly evolving field.